Hello, everybody. This is Cindy Kennedy, and you're listening to another episode of Living with Lyme. I am so excited because I have another nurse practitioner with me today, Lisa Vasile, and she is from Hopkinton, Massachusetts. She is the creator and owner of her own functional medicine practice. It's called the number 4, Better Health. And she likes that one because I'm showing her 4 fingers.
We always say that too. That's so funny.
4. She is an educator. She is a speaker, and her positivity and her true drive for functional medicine led her into more education, looking at holistic nutrition and, a better way to focus on healing people. And today we're going to deal with some different angles. And in the past, we've talked a little bit about functional medicine, root cause medicine, but we're gonna take apart some people and how they deal with their illness and why some people aren't getting better. So welcome, Lisa. It's so exciting to see you because we're both Massachusettsians.
That's right. It's a little cool and rainy here today.
Oh.
Thanks for having me. I'm thrilled to have you. This is great. I appreciate it. And welcome to everybody listening.
Oh, that's so nice. That's so nice. It isn't such a great day after all. But that's okay. It's wonderful meeting people, doing podcasts, and, being part of a community that's trying desperately to get the word out and heal people. You're in, the kind of the 495 corridor, and I'm over in Western Mass. Mm-hmm. And Western Mass people are not quite ready for this. And so bringing about the information about our environment and the toxins and the role of stress involved in our lives is kind of new to them. So, I don't mind educating people at all. I just find that there's some hesitation there. And tell me a little bit about your practice and what the response is in your area, because you're kind of close to that Boston area.
Sure. So we opened 5 years ago, September of 2015. It's a physician and myself and an admin, and we are strictly functional medicine. So we aren't doing primary care or surgical care or pediatrics. It's specialized. So when people are looking for somebody to do a deeper dive into their health, some people are coming because they're sick and tired of being sick and tired. Some people are coming because they have XYZ in their family and they don't want to follow that path. Some people are coming because they have 4 or 5 different either conditions, diagnoses, or medications, and they're fearful or concerned about what the next corner, what might happen next month, next year, and they'd like to slow that down. And then others are coming because they have a true desire to have complete awareness about what might be going on in their body that they're not paying attention to. So a really good example is I had this guy come in, 35 years old, not one complaint whatsoever, slept well, had plenty of energy, happy, worked out, ate great, has no real issues. He said, I want to live to 100 and I want to know, anything that might need to be tweaked now. And I'll come in every 2 or 3 years and we'll tweak. And that way, my chances are higher. So of course we cannot, ever say, sure, we'll make sure that you live to 100, but we can certainly look for things that outside of the traditional screening, which I have no issues with, may be missing some of the more intricacies that you and I have, I know that on your podcast I've heard, share and look for within the functional medicine testing and through the functional medicine lens. So a really good example that might be, when we're going through any kind of medical type training as a practitioner, whether it be PA, NP, physician, you're looking at the person in front of you, you're getting a history. The history is typically a lot longer as you've shared in functional medicine. So instead of anywhere from 5 to 10 minutes, which we in medicine, for those people that are listening, are taught an old cart kind of a acronym, which is onset, location, duration, characteristic of that reason the person's coming in the door, correct? So, and then there's the people that go into a physician for a primary, regular physical, and they might have 2 or 3 things on their list. And I've had some people say, oh, my practitioner said I couldn't talk about any of those because this was a physical and I had to make appointments for that for a complaint visit. So, it is the way medicine is because we're so busy and there's so few practitioners that are doing that type of medicine. So we're also, as the practitioner, taught to do certain testing, whether that be lab testing, and that might be blood work, or it might be stool, or it might be saliva or spit, or whatever it might be, or imaging, right? So you've got your x-rays or your ultrasounds. And if those are normal, then the patient's fine. But fine doesn't mean feeling great, vibrant, sleeping well, having good energy or joy or anything like that. So with functional medicine, we have that ability specifically for something like looking at, the last 6 months in the world, where there's a lot of fear, a lot of stress, a lot of isolation, a lot of different responsibilities shifting of whether it be work or home or computers or whatever. And that level of stress and cortisol and huge drive for that nervous system to be sympathetic, run, flight, that whole is really shifting how the immune system in general, how the GI tract, how the sleeping system, all of those things work, where that may not be something that a lot of practitioners are even delving into.
They don't know how to do it. They don't.
No,
and then they
haven't been taught
get,
it.
yeah. And I understand that because I was on the allopathic side, I probably wiped out more women's B vitamins by all that prescriptive, oral contraceptives that I gave them and hormones, not knowing. We're just not taught that. And one of the problems that I have is when the primary care people feel that what they do is all a person needs, and they're not open to, us helping them. I was really bombarded by 3 primary care docs that wanted to talk more about what I do. And I was like, wow, what a great opportunity. Well, it was not very good because I was accused of spending their money. So a particular patient that I had done some functional labs and she wanted to run it through her insurance company. It basically pulled away from the pot of money that they had to care for this woman. So if in fact she had gotten sick and they ran out of their pot of money from that insurance carrier, then they would owe them money. And I'm like, well, geez, I'm sorry. Actually, I didn't know that. And
but regardless, you're trying to prevent her from getting sick.
well, see, that's the point.
That's prevention. It's not retroactive or reaction care. It's preventative care, right? So that's different.
Exactly, sure. Exactly. And I wasn't in a position to face an argument because I was too new at it. And it's interesting because I got an email from a primary care person because the patient that I'm caring for, I suggested some labs that, if you're going to your primary care and we're going to be looking at your level of, energy, let's really check thyroid, not just a TSH, So I gave a couple things. I suggested a D, I suggested a B12, and a magnesium, nothing crazy. And I got an email saying, are these the usual things that, now I could have interpreted it wrong. I could have, it could be a very kind, oh, are you interested? Is this what you're going to be doing? Maybe, maybe she left out the part of, maybe we can work together and really form a bond and help each other. Because truly, think about it, Lisa, if we take a person who is overweight, high blood sugar, a high insulin, fasting insulin level, their hormones are all crazy, and we really work and resolve those and get them geez Louise, the primary care people are going to be excited. There's going to be less people, sick in their office. And I think it's helpful. So, not only, as I spoke in the beginning about, I've got to educate the people, we've got to try to soften and educate these primary care docs.
Well, and I do think that that's a position that we have an advantage in because we are practitioners. So I know that that's a huge goal of mine, and I've been working pretty diligently to try to expand that And you know, because it doesn't have to be them and us, not only in the care model, but also in the ability to utilize functional medicine. Now, I know that they only have anywhere from 7 to 10 minutes, and that's not their fault. That's the way it's set up. They're busy. You know, and the many practitioners are amazing docs, PAs, and NPs. So if they've got less time and they've got somebody coming in, and they have they have the intuition because of a functional medicine lens versus just the traditional, using the both, because there isn't them and us, it's more of a bridge, right? So if we're able to sit on that bridge and be able to say, you know, wait a second, you know, you just mentioned a bunch of things that sound like low B. Let's look at your B vitamins. Let's look at, you know, a vitamin D. Let's look at an iron and maybe a ferritin. But many times there's a limit to what the practitioners can order, right? A lot of these umbrella practices have restrictions on lab work. And then there's also that idea that it can't possibly be nutrients because we get everything that we can, that we should in our food. Well, that would be true if the people were actually eating most of the people that are out in the traditional allopathic world, so to speak, aren't as aware about what whole foods and the nutrients in those look like in the body compared to, and are utilized compared to a packaged food or food that comes through the drive-through window, right? And so it doesn't have to be, oh, gee, you're eating McDonald's, you must, you know, condemning them, but more so your diet isn't optimal. Let's look at some nutrients, and at least we can optimize those because it might help you feel better before we order, you know, an MRI, say. And so, you know, you have constipation and you have insomnia, you have anxiety and high blood pressure. Well, it sounds to me like you have low magnesium. So we don't even have to test it. Let's see what happens if you use a little bit of magnesium, of course, if the kidneys are fine. And then if they do feel better, well, then you've just fixed something without spending money for that patient. And these kind of things can, and I believe will be, hopefully, that's my push,
Right.
done in the traditional world, infused into their practice as it already is.
Right. I get upset when we're looked at as supplement pushers. You know, it's bigger than needing supplements, because there are some people whose palate are so finicky that you're not going to get them to eat a higher quality vegetable nutrient dense diet, and you know that's what they need. You know, this whole run of people that are vegetarians and now vegans that aren't feeling well, their carnitine is down, their B12 especially is down, all kinds of things like that. And yeah, we just try to make them feel better. We got to supplement with some of these things. And, you know, it's very hard. And, you know, both of us are involved with School of Applied Functional Medicine, SAFM, with Tracy Harrison. One of the things is meeting the person where they're at. And I remember one of the stories that Tracy was talking about, and there was someone who really needed some coaching, some information, and some diet changes. But she was so busy. She was, you know, 2 times a day, fast food, picking up and da-da. So she just reorganized and put into this woman's mind, these are better choices at, you know, XYZ drive-through or whatnot. And she actually improved. She lost a bunch of weight and whatnot. So, you know, it's not like I wouldn't suggest that people eat fast food. You know, there's a lot of different things in there that we don't want in our bodies, but meeting the person where they're at. So if in fact I can't get them to eat any animal protein, well, how else can I do it? You know, what else are other options for you? Or what are
And
you
I think
willing
that's
to
something
do?
that not only we can do, but that all practitioners can do.
Yeah,
But there are so many times I can tell you that I have never once been asked. I'm guessing because I've never been overweight, but I've never once been asked what my diet is, ever.
No.
In a practice, in an appointment at a practice. And so I'm 52 years old, and not once have I ever been asked that. Now, I am celiac, so I will have, you know, a new practitioner will say, you know, do you eat any gluten? And I'm like, well, no, I'm celiac. And they're like, oh yeah, but some people do. And they're right. They're absolutely right.
Mm-hmm.
So good for them.
Yep.
And, you're looking at, so what does that mean to the rest of the world? So the only time that we're discussing diet potentially is when someone's either has a diagnosis of metabolic syndrome, diabetes, high blood pressure, high cholesterol, and or obesity, right? And so, well, that doesn't make any sense, right? So how many times have patients come into my practice with horrible IBS, and never once have they discussed or anyone's ever asked about their diet. And in fact, more than half the time that patient has said to the GI doc, well, I've read about either a FODMAP diet, low FODMAP diet, or a gluten-free, or do you think it's dairy? And they'll say, they'll always be okay with lactose and dairy, but for some reason, the rest of it, they're somewhat resistant in. And I'm not saying all of them. This is some, the majority of the people that come into me, some of them sharing this with me. And so that would mean that something that you're doing 10 to 15 times a day between eating, snacking, and drinking, from the mouth to the anus, the pipe that goes all the way through where all of that food goes, has zero effect whatsoever on the body except for gaining weight or causing blood pressure or causing diabetes, right? Which is ludicrous. And so, thinking about how can we re-educate and re-support the practitioners so that so that they understand that what we're eating can really impact both culturally, nationally, women versus men versus, different ages, and that nutrients, not just what you're eating, but what those numbers might look like are hugely important, that those in fact may actually affect neurotransmitter production, right? So people think for the most part that you make your serotonin in your brain, which we know that that's not true. You make it in the gut, you make it from your food, and you make it from your nutrients. What does that look like for detoxing, right? So the theory in traditional medicine is that your body, you do not need to support detox whatsoever. Your liver does it all. Well, there's a lot of people, and rising. 50 years ago, it was maybe 10% of mostly morbidly obese diabetic men that had fatty liver and or alcoholics. And now we're seeing up to 50% of kids after the age of 15 have fatty liver. And so those livers really are not doing what we think that they're doing. So being able to educate not only the practitioners, but the community as to what kind of things increase the risk of the body working really hard, and what kind of things can really help it to work better, right? So looking at what I like to say, body balance. What can you help to balance it better? And what is a burden that you can help to reduce? Maybe don't go through the drive-through every day. If you want to have a treat twice a month, great. These are the options I would choose there. And what does that look like, again, on your neurotransmitters, on your sleep, on your energy, on your joint pain, on your IBS, on your, the rash on your skin, you name it.
I'm laughing because our programs are a combination, myself as a nurse practitioner and Kara, who is actually my oldest daughter. She's a registered dietitian, functionally trained. So, our programs are both of us, and we just, people understand that, the diet is really key. Some people think they eat great and they might eat well, but not the best that they can. So anyways, the component is the both of us. And so I have a young woman come in, and she just, her dad is helping her pay for her appointments with us. And so I said, okay, so your next appointment, you're going to meet with Kara, and we're going to get and she's very finicky, and she's, hesitant, and anything you mention, she's an adult too. And she's like, ew, this whole thing. And I was like, oh my God, we're really going to have a hard time here. And so she says this to me, because I said, your next appointment is with Kara. And she says, is she a jerk? Is she going to be mean to me? Like, well, that's not what we're trying to do here. No, she's not going to be mean to you, but we're going to make some suggestions, because maybe we can take things that you don't like, to the taste of or the texture. We're going to work it into something maybe that you do like.
Right.
And I said, okay. So she stands up, and I see her dialing her phone. I'm like, oh, I'm sorry. Do you need some privacy? Whatever. She goes, no. What does she do? She's calling a Chinese restaurant to order her egg rolls. And I tap her on the shoulder while she's put on hold. And I said, why don't, instead of the fried egg rolls, why don't we try something different, like a spring roll? And she's like, ew. I'm like, okay. So the whole thing is, you can lead a horse to water. You can't make them drink, right? So what do you do?
And so for someone like that, what is their pain point? What is their reason for coming in? And what does that look like? How much are you willing to change your diet? How much are you willing to support, all of these other things that are the burdens, right? So that's a direct burden. If we think of anything that you're putting in your body, whether that be water, thoughts, joy from, other people, or anger from other people, TV, food, think of it like is this adding a deposit to my health bank, or is it actually a withdrawal from my health bank?
Oh, great concept.
And, so you don't have to be perfect. No one does, right? So you can withdraw, you can go to the ATM here and there, you can have a little fun on the weekend, you can go away for, for a weekend with friends. You can go skiing. You can do things that are, maybe buy that manicure that's toxic and but it looks pretty. But what are you going to do to balance that, right? So to make sure that you're always in the positive at your bank account versus complete, way negative and deficient bank account.
You mentioned joy. Can you talk to the idea that a lot of people, especially during COVID here, have lost a lot of their joy?
Yeah, I would say that this is a huge issue. So over the course of the last 6 to 7 months, like I said, we've had quite a bit of a physiologic, emotional, psychologic attack on all of our psyche. And so that comes from joy, that comes from passion, right? So vitamin J and P. And so thinking about, what people's joy and passions have been really squashed. And they have had a lot of isolation. They've had a lot of toxic information brought into them on a regular basis between people. This many people are dying, this many people are positive, this many, red state, not red state, how many people, whatever. And then, whether it be, I'm not getting political, but the actual politics infused into that for the virus, but also for the actual political race is really upregulating a lack of joy and a focus on the things that are negative and absent, as opposed to the things that are wonderful. You asked when we came on off recording, how is it? I'm like, it's great. I'm blessed. Things are weird and things are a little boring, but for certainly, you have to look at the joy. And if you are waking up on a regular basis and you're fine, or you're getting through the day, then there needs to be an adjustment, because that's sucking the life out of people. Mental health is at an astronomical level right now. And so when we look at, even you mentioned women, forget what it was that we were talking about, but the idea that women, especially, not that men aren't stressed out, don't get me wrong, but when we look at the responsibility, especially say of a mom that might have a family member that's older that they're worried about or taking care of, right? You've got that sandwich effect, and then they've got their family, and then if they're working, they've got, how do I work in this kind of an arena while my kid is sitting here trying to get on a Zoom, Google Classroom, and their college student is in the other room screaming because they want to be at college, and they're trying to run a business, and there's no access to a lot of things that help them run that business. And so the stress level is astronomical. The exposure to chemicals tends to be higher in women. So, whether it be hair products, makeup products, skincare products, the cleaning products that we're cleaning the house with, not that men don't do all these things, but for the statistic,
right. We don't want
dry cleaning, looking at, you open the dishwasher and get that blast of clean, all of those things that are increasing our exposure. I think it's like 15 to 30 things a day that women do, and men do one, right? They use the bar of soap to wash their hair and their butt.
Yep. Pits and parts, honey. Pits and parts.
Right. Their peach and their pits and their peach.
Yeah.
So
peach. Woo.
So, what does that mean for autoimmunity, right? So our hormone are always going up and down, and you add cortisol and insulin hormones to that, and low D to that, which are also hormones, thyroid to that. And so women are it's like 4 out of 5 people that have an autoimmune are women. And then in traditional world, you have an autoimmune. We don't know why it happens, but most people, it runs in the family. And if you have one, you have a risk of having another. We'll treat the symptom. You'll never get rid of it. Your risk of getting another is high. And that's kind of where we're left, right? So in the functional medicine world, we kind of understand that we can't diagnose specifically this one thing caused you to have, let's say, autoimmune or cancer or whatever you want to look at. But we know that those things are higher for women, and that those are 100% at play. And if you can, again, balance those, reduce the burdens, you can at least slow down and way shut off that autoimmune activity. You may still have an autoimmune similar to me. I'm a celiac. I'll be celiac forever. But that autoimmune activity has been shut off for 10 years. So,
right. You're not pushing the buttons. You're not pushing the buttons.
Right. So pushing the buttons, continuing to add the burdens that are upregulating the body's innate need to be resilient and to fix, right? So it goes into fix it, repair. It just kind of gets snowballed into an inappropriate behavior.
Right. You can't shovel against a tide, right? And that goes, people have to look at their environment and what they're exposed to. And we know there is so much more toxins in the air, in the water, in our food. I was at my orthodontist. I'm one of those older people that had braces, but went and got braces again, just to straighten things out. Anyways, and I was talking to him. This is, an educated orthodontist. And he said, "Hey, how's business doing?" And I'm like, "Hey, we're open now. We're running our sauna. We got people in there detoxing, chemical." He's like, "Hmm?" And I'm like, "Well, things that are used, glyphosate, he goes, "How do you spell that?" I'm like, "Have you ever used Roundup?" And he's like, "Oh yeah, I use it all the time." I'm like, "Well, you got to stop using that. Why don't you go look up glyphosate and learn how it's causing all kinds of problems, and it's been linked to cancer." And he's like, "Yeah, I'll do that. But it's education, because, the whole thing, when you said mental health, the issues with mental health, with stress, with poor joy, with poor release,
lack of passion, lack of purpose.
Yeah. All of those kind of things are leading to this overwhelming toxic burden. And the thing about the mental health part is people are leaning towards things that are even less healthy than they did before, because there may not be out and adventuring as much, different places, or going to movies, or, doing these things.
And I think a lot of the community that helps to maybe keep them on track. For me, my gym crew is, we see 3 of us outside across the parking lot from each other because we can't be closer than 10 feet apart. You can't be at the gym. I mean, you can't be in yoga. I have an outdoor yoga that I use, a beach yoga that's, 5 people can go at a time, and it's spread out, and it's not that hot yoga with the community. It's not the people that maybe that you walked with every week, because those people maybe now are stuck inside on Zoom. So I do think that there's a lot of that, but there's also a lack of attention to how do we then go ahead and balance it, right? So, a 5-minute meditation on Insight Timer, which is completely free. You can go put your legs to a wall, put your feet up in the air, bum against the wall, and listen to 2 songs that really rock your world. It can be hard rock, it can be Enya, it can be whatever it is, but upside down, feet up in the air. It can be, how do I go upside down? I have a lot of my patients do down dog to child pose. Mm-hmm. Do it for 4 minutes, 3 to 4 minutes. You don't have to be good at it, but just do it upside down and then child pose. It's wonderful for being upside down and being stretching, but also you're getting out of life for a minute. Mm-hmm. You can do Qigong, you can do tapping, you can do all of these things that are 100% free, and YouTube is there for you.
Yeah,
even
YouTube,
the meditation.
Great stuff. But in terms of things that have exploded during this time outside of Amazon, is alcohol sales. Have you
Yes.
seen the surge of numbers? And gosh, that's going to play a big part on people's health, and some people have stopped going to their well visits, let alone, kind of hesitant to even get out to a doc when they're sick. I think things are getting a little bit better, although we've, right now we've had a little bump in our cases. But we have to keep on this stuff, and we need to find other ways. You got to be creative. And, for some people, they've been really killing it during this time with using Zoom and, putting things out on YouTube or whatnot, or buying programs, things that they can do in their home,
Right.
whatnot. But, I think that for the most part, people have now become a little bit less healthy. And we know that, 45% of the population carry at least one chronic illness, quote unquote, diagnosis. And that has trickled down to children and the
Right.
rate of obesity in children. And I think you're a product of your environment, what you've known. And to be healthy, sometimes you have to be different. You have to go beyond what the norm is. You have to ask questions. You might go to a restaurant and just, oh, you're dying for the chicken parm. You got, okay, well, all right. But you got to know too that they may not be utilizing the best oil. Not everybody uses organic EVOO, right? So you need to know that,
Right.
because that's important. Not
Well,
that
and
you
I
might.
think, even for people that are, there's most people that are in the last, anyway, this 2020 has been a little unusual where people are forced, for lack of a better word, to be at home and to cook. And it's so much easier to do it out of a box than it is going to a grocery store quite often, especially when there was very little in the grocery stores, when there was crowds and fear. And so when you look at the difference between what we might have been eating this time last year versus this year, I would say people that go out to eat, they probably overeat, but they might eat a food like a salmon or a big giant salad that they might not make at home, where they're not going to make that at home.
Yes,
And I think
yes.
that what you said
That's a
about
good thing. Yeah.
yeah. So, I think that the being able to think about what are 4 or 5 different rules that you can incorporate, because it is a learning process. And to your point about being different, most people that are working for a healthier, especially when we're talking about food, right? People say you'll change religion before you'll change your diet. And so, if you think about what you're eating and what you're used to, because that's cultural, that's, you have the thing that your mom made or your grandma made, that is delicious. We're having a shower with somebody that grew up in Poland, and this was the apple sort of fritter that she had in Poland, and that's what we're going to have for a shower, Americanized sort of. And so there's things that people are very connected to when it comes to food. And so if you can decide, to your point, when you said that about what can we change. So if I say to somebody, can you just try to get at least every color of the vegetables in every single day? And if that means you dump it all into a blender and throw a bunch of chocolate protein powder, go for it. So
Exactly.
that you're at least getting the colors in every day. And what does it look like for how much meat you're having? Can you cut it down so you only have it once a day? And can you make it real meat, not processed meat? And what does that mean for a sandwich? Or that just means if it's too hard for you to cook a chicken, go get the one that's already cooked. It may not be to your and my standard or your standard, but it's still better than a slice of turkey meat, right? Just cut it into slices, put that in the fridge, and then put that on your sandwich. And maybe instead of bread, put lettuce around it, and then you can cut that out. So different ways that you can kind of incorporate. Well, I don't really like water. I hate water. Okay, well, do you like lemon? Do you like lemonade? Yes. Okay, well then go and get some lemon flavored Ultima and drink lemonade all day. And so that you're giving them options of being able to incorporate a healthier variation of what they're used to.
The whole thing about joy, going back to joy again, people find joy in their food.
100%.
I think it's important, and to relish in the fact that you've got a plate of food in front of you. It's that mindfulness that I try to remind people that they need to be aware. You got to be present, and there are things to find joy in. What can you be grateful for, and what can you be, joyous about? And it can be something simple as a wave from a neighbor. It can be that you got, lapped to death from your dog, or you got a great phone call. People dismiss
Right, and I
all
think,
of the little things.
well, and even the how you're viewing it, right? So a really good example of the last two things, and I'm laughing it with my husband. I'm like, this is so us. So I looked out the window this morning, and there was the most crazy, gorgeous, red, beautiful sky for sunrise. Sunrise here in Massachusetts now is about 6:30, 6:45. So I didn't get up at 4:30 a.m. for those people that are listening. So I was sitting here, like, oh my goodness, it's so gorgeous. So he walks over, he goes, meh, red sky in the morning, sailors take warning. It's like, it's a completely different way of looking at, like, okay, that was beautiful, and you just shut it right down.
Yep.
Or, gorgeous foliage this time of year, and he's like, oh, it's going to be a lot of leaves to rake. And I'm like, okay,
Half full, half
yeah,
full.
you really need to look at the other side of the world.
Empty. Yeah, I know, but ultimately, is he a happy fella?
He's a very happy fella. So looking at, but I will say that this has been challenging for him. So he's a teacher. He, was ripped out of his classroom and then put back into this thing that they call school, which isn't, what he can't teach in 8th grade in a mass with half people there, half people not. It's really very difficult. And the stress on most humans right now, whatever their role looks like, as the parent, as the teacher, as the student, and as those of us that are with those people, or those of us that are working in the healthcare, or those of us that are in dentistry, or trying to do a massage. I mean, none of it is normal or comfortable. And so that in and of itself, on a regular basis, getting out here in Massachusetts to go into any store, it's a mask on no matter what, at least in our area. And so, it is not, it's not a level of comfort that any of us have reached. Nor I don't think we will, and maybe we shouldn't. But at the same time, I think that underlying continual burden does make it difficult to balance that joy and that purpose and that passion. And for him, his joy, passion, and purpose is to make those 8th graders laugh. And it's very difficult to do that when you're in an environment like he's in. And he was out of work for so long, and then your purpose is gone. And we did a ton of housework, little house projects, but looking at what does that look like for a healthy, happy person when, in a stable relationship, in a stable home, and finances are pretty good, thankfully. But when you look at people that do not have that kind of resource and don't have a wonderful, his family all lives in town, so he's been able to see them. And that is a huge difference to what a lot of people have been dealing with for the last 7 to 9 months. And we'll have to, unfortunately, for the near future. So, and then getting back to just even what you talked about with being that healthy person that's making different choices on a regular basis. I did mention that I have never been overweight, but I was extremely underweight. I'm 5'8", and I was 114 pounds when I graduated high school. And nobody diagnosed that celiac thing until I was 37, by the way. So when I was that, it was the opposite of, I was uncomfortable with the way I looked. I did gain quite a bit and be able to be in a steady weight, but my mission for putting the food in is information to my body and trying to stay as healthy as I can. I have family history of, my mom died very young of a very progressive dementia. And so, that's kind of haunting all of us, like, oh geez, which one of the 4 of us is going to get hit in the head with mom's thing? And so you have these goals for what drives you to be healthy. And I think that's a huge, important differentiation from the norm, which is, I want to lose weight and look good in a dress, or look good at a wedding, or a reunion, or, fit into whatever it may be. Instead of that, I really don't care what size people are, but I really want to know what's going on inside their body, which is a little different, right? When you're looking at, it's not just eat less, exercise more, because sometimes that does horrible things to our sympathetic nervous system, right? If we go back there, it does horrible things to the metabolism and the endocrine system and the neurotransmitters. That kind of thing is different in the functional medicine approach. And that kind of approach of what you're doing with me when you come in my office is, sure, I definitely don't want you pooping 17 times a day. I will help you with that. I definitely want you to sleep more than an hour a night. I will help you with that. But what we really need to work on is, why is it all happening to begin with? And that might be, I want you to be healthier 6 months from now and 6 years from now. The expectation that 6 years from now, I'm going to be almost 60 and be older and dumber and less energy and less vital. I don't accept it.
Yeah, people
So that
accept
whole,
it. That's
the
the
whole,
word.
and it's not just the people in the community, Cindy, it's practitioners. It's your mom, your dad, your cousin, your aunt, your coworker, who are feeding this perpetual aging is deteriorating mentality. It is expected. It's just part of getting old. So when I was 40 years old and my mother was losing her marbles at 62 years old, my doctor said to me, yeah, it's just normal. When you get in your 40s, you're busy with your kids and no, I had rampant heavy mercury toxicity.
Ooh.
And my B12 was like 97. Nobody tested it until I went to a functional medicine practitioner. So no, it wasn't. And I'm much more clear, and I don't have the dementia type symptoms that I was having at 40 at 52 years old. And so that whole, it's just part of getting older. Your bones are going to break down. You're going to be tired. You're going to hurt the people that tell me they feel like the Tin Man when they get out of bed in the morning, it's just normal, I'm getting older. No, it's not.
Yeah, and one of those doctors that, had their time with me, the total ambush, said, that he has a lot of complaints in terms of, muscle or joint or whatever. He goes, it's just because I'm getting older. And I was like, well, no, it's really not that. And then the conversation about Lyme disease and how it's just a bacteria, and anywhere between 14 and 21 days of antibiotics it's fine. And all this other stuff that happens after, that's not anything to do with Lyme disease. So, the focus is completely different. And you really have to have that good feeling when you're seeing a practitioner that they're taking care of you, because having that insight and actually feeling that joy that someone is listening and helping is all part of that healing phase. Because if you are constantly in that sympathetic nervous system mode, you're being chased by the cougar, you can't heal like that. And I think bringing that joy in, bringing that awareness, doing some self-care, really taking that time. I counseled a woman yesterday who's got 3 children, 4, 6, and 8. She's dealing with a bunch of gut issues that we're working on. She needed some words, how to handle things. And I gave her permission to say to her family, because hubby's at home working, she's out in the community, she's got a managerial position. So she's got, she's managing people, but she has to answer to the higher ups. So she's really got that compression syndrome, with she's getting squeezed in. She felt bad that she came home, shut her door in her bedroom, changed her clothes out of her work clothes, and just laid on her bed for 5 minutes. She goes, boy, did I feel better after. I go, you feel guilty about that? Do you see the benefit that you were able to really be present with your family after that? Say to your kids, hey, mommy needs a timeout. Say, I need. Tell your husband what you need. And I think people are afraid to do that for fear that they're not doing what they quote unquote should be doing or what's expected of them.
Right. I mean, I do think that there's a societal necessitation for proving that we can do it all.
Yeah.
And at the same time, there's a female lack of ability to do that one thing, which is speak up for what either isn't comfortable for them, what they do or don't like, moving a job, saying I don't love being home with my kids all day, or I want to be at home with my kids all day and not working all day. And I have made this remark often where women are constantly doing this in their brain, where men are very good about compartmentalizing that kind of thing. and not all, again, I don't want to generalize for 100% of women or men, but a really funny story that I tell people all the time. My husband and I were driving to yet another lacrosse game, and it was busy, and I had been on the phone, and I had been trying to get something done on my phone, for an email, for a prescription. And then I was like, holy crap, it had been a half hour. I shut my phone off. I put it down. I said, I am so sorry. We're driving. That was rude. I just looked, I'm like, okay, so let's talk. What are you thinking about? Like, instead of me being, and he goes, thinking, I'm driving to the lacrosse tournament. I was like, oh my God, you really do just think of the thing that's in front of you. And he's like, I don't know. I was kind of thinking maybe what we do tonight. And it was really so completely lack of stress, right? And so that you need for us to sort of be run is self-imposed a lot of times. And if they want to go for a run, or they want to go golfing with a buddy, or stopping on the way home to see a friend, they're like, hey, I'm going to stop. But we don't do that, because we got to get home, and we feel bad if we do that. And so there needs to be an okay, Tuesday and Thursday you do that, Monday and Friday I do it, or whatever it might be. That, I need my 5 minutes laying on the bed for sanity.
Yeah. Yeah. And I ask people, like, if they come out of the sauna, or they come off of the biomat, or they finished with a yoga class, and I happen to greet them in the hallway on their way out, I'll say, stop. How do you feel right now? And some people say sweaty. Okay, well, that's good too. But, well, tell me. And they're like, and they take a breath, and they go, I feel good right now. I feel good right now. And if they have something like, well, I don't know how long it'll last, I'll say, no. Focus on right now. Focus on how you feel right now. Enjoy that. Find that joy in that right now. And we'll worry about not feeling so great, in a day or two, or whenever it is, when that time comes, because you can have this, and you should be aware of this right now. Because I have some pretty sick people. A gentleman that's been diagnosed with ALS, and I was for sure convinced it was toxins. I have another gentleman that it's just been a long struggle with Lyme, and then heavy metal toxicity, and now it's a prostate issue that he needed surgery for. I mean, it's a lot of things. And creating that space for someone to enjoy themselves, even for a short time, if you can do that almost every day, it's sure to shift that emotional craziness into that safe space to allow our body to digest, and to heal, and to detoxify.
Right.
Do you like that?
And it's so much less exhausting. I mean, it's so exhausting, and just life sucking to be on the go all the time, and to be worried all the time, to be fearful and anxious, and it's exhausting. And so if you had a 5-minute quiet time where you just visualize, even if you fall asleep for 5 minutes, it's so amazing for the body to reset, for sure.
Absolutely.
Yeah.
Absolutely. This has been a great discussion. I think it's good for both of us, supporting each other, because it can be stressful and not great for us. There's, not every day is a great day, but there's got to be something we can be joyous about on any day, even the bad days, right?
100%. Always.
Yeah, it's been such a great pleasure. It's been a great pleasure to meet you and to talk with you. We've had great conversations, even texting back and forth. It's been fine. So
I mean, I think the coolest part is that, there's more and more and more of us. And the idea that we can continue to share the gift of incorporating more into the toolbox for the practitioners, but also for the community that are listening. And to not allow the whole "you're fine," it must be in your head, or maybe you need an antidepressant, or you probably just need to sleep. I think, or you're melodramatic, whatever it may be, because I really feel like there's a lot of people who may just need, like we talked about, a little bit more love, a little bit more joy, a little bit more sleep, a little bit more comfort, reassurance, but also, eating the rainbow, trying to, thinking about what, it's not rocket science, but it's a day in, day out support. And that's where all of us can come in. And those tools in the toolbox are huge.
That was a nice little package you just ended with. That was everything in one little package tied up in a bow, and a great takeaway. And it's, you know what? It's a takeaway for the practitioners too, because we need to be feeling our best in order to provide that service to the people with a clear mind and really an open heart. I find that being a real person and listening and just being silent sometimes for 15 seconds really allows that person to kind of think, that thought, especially when there's been a question before it.
Yeah, that's great.
Yeah. Well, for you,
Thank
hang
you
on
so
there.
much.
Don't be leaving me there, Lisa.
Okay.
Well, for all of you listeners, you have listened to yet another episode of Living with Lyme. If you haven't subscribed to the website, please go on to www.livingwithlyme.us, like United States, and get acquainted. And for all of you people who are looking for more functional health, you can see Lisa Vasile. Lisa, give us your website.
The number 4, betterhealthmedicine.com.
Yes, and that's wonderful, wonderful thing to at least look into. And for me and for my daughter Kara, www.pursue, Pursue, wellness.us. You know what? Find some joy. That's what I want y'all to do today. All right, you take care, people.
Take care, everybody.
Till next time.